Gaining freedom from health debt is really what this podcast and GreatMed.org is all about, putting power in your hands to improve your God-given ability to be healthy. Many people with preventable disease want to make lifestyle changes. They want to improve or reverse disease, but they don't know how. Walk, Don't Run to the Doctor is the resource hub that is a cure for a common confusion about healthy living. Are you taking a vitamin D supplement because health professionals told you to, or for some other reason? Maybe you shouldn't be, and we're going to be talking about whether vitamin D supplements really do what they are hoping to do. And if not, what are your alternatives? I'm Miles Hassell. I'm internal medicine at St. Vincent Hospital in Portland, Oregon, and we're here to discuss lots of things in GreatMed.org, but today we're going to be discussing vitamin D and your health. Let's just touch a little bit on the whole issue of nutritional supplements. They're commonly used, and they, to coin a phrase, swallow a lot of our patients' time and money. And in most cases, unfortunately, when studied properly, such as in a randomized controlled trial, nutritional supplements have not been shown to be helpful. In most cases, there are exceptions, and we'll touch on some of them. They can also produce harm, and the harm can be from a couple of reasons. One is there can be a direct toxicity with them. And secondly, they often give people a false sense of confidence. If they're taking a nutritional supplement, maybe they don't need to exercise. Maybe they don't need to lose weight. Maybe they don't need to eat better. And these are all factors. So we think that the evidence is very strong that eating well, exercising, and weight management are where we should focus, but they're also harder. And before we dive into vitamin D specifically, let's think about nutritional supplements as a group in general. And so you walk down the aisles of any supermarket or pharmacy or Costco, anywhere, and you'll see a huge range of supplements. Maybe it's going to be at your naturopath's office, whatever it is. And the problem with nutritional supplements is that in most cases, they do not improve health when they are studied. They're mostly based on faith. And that would be fine if they didn't cost money, take time, have potential toxicity, and give people a false sense of confidence. I can't tell you how many people I see who are taking multivitamins or whatever, calcium, vitamin D, and they're not exercising. They're not eating right. They're not watching their weight. And yet they think they're doing something for their health, and most of the time they're not. So once again, before we get into the vitamin D area, how do you decide whether a pharmaceutical, such as a vitamin supplement, is worth taking? First of all, any pharmaceutical, including nutritional supplements, should not be used unless there's some reason to believe that they will improve your health. And that can be measured primarily in two ways. One is evidence from well-done medical trials. And the second is, if no such evidence is available, at least an improved well-being in some objective fashion. So, for example, a nutritional supplement that I prescribe is niacinamide. Somewhere around 1,000 milligrams a day seems to reduce your risk of certain skin cancers significantly. We use it for osteoarthritis joint disease, and we can point to evidence from both randomized controlled trials as well as people's experience of simply getting fewer skin cancers compared to what they historically have experienced. So, but very, very few supplements meet that standard. And some people, when I mention that nutritional supplements are pharmaceuticals, they get a little bit disturbed and they say things like, but my supplements are natural. And I submit that your supplements probably aren't natural, no matter what the salesman is telling you. Almost all nutritional supplements, including most protein powders, are chemicals produced in big chemical factories, typically overseas. As such, they are quite dissimilar to the equivalent nutrients found in food. They don't come with the same metabolic cofactors that are found in food. Neither do they, in most cases, there are exceptions, but in most cases, neither do they have evidence of benefit. And we're going to talk about the evidence, and remembering that those who say that they don't study nutritional supplements, so how do we know whether they help or not? They are against nutritional supplements. Well, they are not against nutritional supplements because there is a ton of money in nutritional supplements. And there are tens of thousands of papers out there on nutritional supplements. And we're going to be looking at vitamin D, and there are thousands of high-quality studies on vitamin D. So anybody who tells you that nutritional supplements are not being studied is making it up. And the vitamin companies certainly have the budget to do more studies than are currently being done. In fact, if you look at the studies out there on nutritional supplements, very few of them are done by the nutritional supplement manufacturers, and very few of them are done by academic centers for naturopathic medicine. Mostly it's done by conventional medical sources. So look behind any nutritional supplement that you're using, find out how they're made, and whether there's any evidence for benefit. And now we will get on to vitamin D. So background. Vitamin D is a hormone made by the body in most cases, or it can be ingested, such as in a supplement or a food, and is essential for health. Vitamin D deficiency is associated with an incredible range of disease, diabetes and cardiovascular disease like heart attacks and strokes, high blood pressure, muscle loss, osteoporosis and bone breaks, depression, chronic pain. It even is associated with a higher risk of dying of any cause over the course of the study, whatever study that we're dealing with. So vitamin D is really important, and it's something that is not technically a vitamin, but it's technically a hormone. But because it was labeled a vitamin in the early 1900s, then it's continued to be called a vitamin since then. So we're going to just for a minute talk about a technical aspect of vitamin D, and that is how do you measure it? So there's two areas of measurement. One is what's in your blood, and that can be measured as nanograms per milliliter, which is what our lab reports it at, and normal is probably about 20 to 50 nanograms per milliliter in the blood. You can also be, in some labs, you'll see it reported as nanomoles per liter, and the normal range for that is probably about 50 to 125. And so it's important when you're reading things about vitamin D to realize that there's two different ranges that might be reported depending on which units they're using. In terms of how much should people get per day, the general estimate is somewhere around 600 to 1,000 units. The other people's recommendations vary extremely widely, and that's about 15 to 25 micrograms of vitamin D. And then, of course, to add to the confusion, there are different compounds that are all called vitamin D. So you've got D2 and D3 and even D4, which is in mushrooms. And then in rare cases, as a pharmaceutical, we use something called a 125 vitamin D or calcitriol for certain people with certain illnesses. So there's a lot of different aspects to vitamin D in terms of technical aspects. And part of the complexity is because the metabolic pathways for vitamin D are incredibly poorly understood. There are multiple pathways and involving just about every part of your health, every part of your body, every part of your organ systems. And when we look at the blood levels that we were talking about a moment ago, I think everybody can agree that levels below maybe about 50 nanomoles per liter or 20 nanograms per milliliter are associated with strikingly increased all-cause mortality, cancer, heart disease, respiratory deaths, you name it. And oddly enough, where we run into trouble is knowing how high it should be, because depending on what disease process you're looking at, you get dramatically different results for the upper level. And so in my practice, we generally say that you should probably be somewhere between 50 nanomoles per liter and 100 nanomoles per liter, or 20 nanograms per mil to 40 nanograms per mil. And that's probably the levels that are associated with the lowest all-cause mortality. And as you go above those levels, then you get higher and higher all-cause mortality. And yet, we'll mention in a little bit that depending on what disease process you're measuring, you might actually come up with quite a different area range to recommend. So how do you get vitamin D? Well, we're going to be talking about synthetic vitamin D in supplements. And that's also the same kind that's in fortified foods. Like a lot of milk is fortified, and that's still dealing with the synthetic vitamin D. And that can be D2, which is ergocalciferol, or D3, which is cholecalciferol. They're made slightly different ways, but they're all synthesized. And then, more importantly, we would argue for health, there's sunlight, there's oily fish and cod liver oil, there's light-exposed mushrooms, and then there are other sources as well. For example, even dark chocolate has metabolically important levels of vitamin D. Some of you will be glad to hear about that. And so when we think of those sources that I just mentioned, starting with the supplements, which are nice and easy, relatively inexpensive, then the question is, do the vitamin D supplements improve health outcomes? No, I'm not talking about improving your blood level. We're not talking about a number on a piece of paper. We're talking about, do vitamin D supplements, the synthetic pharmaceuticals, improve your health outcome? Or are they just another example of big pharma that's run amok? And so let's look at some outcome studies. First of all, when you look at severe vitamin deficiency, so that's levels of less than 30 nanomoles per mil or maybe 12 nanograms per mil, that's, you replace that by whatever means necessary. We don't see it too often in the world I live in. Naturally, you might guess I would prefer to have that replaced with a natural source. But if you have to use a synthetic for that, use a synthetic. But as I said, that's pretty unusual. And those are the people that are at risk of diseases like rickets and osteomalacia, which is not typically what we're using vitamin D for in the real world. And so then we move on to the typical levels of vitamin D and the typical levels of vitamin D supplementation that are used. And by and large, those don't work. And so when you're looking at vitamin D studies, discern between studies done on blood levels, where the higher blood levels are better, and studies done on supplementation, where the higher blood levels are achieved with a synthetic supplement. And ask yourself, what else do people with higher vitamin D levels that have better outcomes have in common? Are they thin? Do they spend more time outside in the sun? Do they eat more oily fish? And so on. So let's look at vitamin D supplementation in typical community dwelling people. So these are people living normal lives, or going to work. They live in houses. They eat normal foods. And tens of thousands of people like this have been enrolled in randomized controlled trials. So these are studies such as VITAL study, VITA, D2D. There's a whole bunch of them. And they're all really well done. And what we find from these studies, and the studies are in the show notes, so if you want to look them up, is no benefit for cancer prevention, no benefit for heart disease and stroke, no benefit for falls, no benefit for total mortality, no benefit for COVID-19. And so these are studies using nutritional supplements, and yet if we look at free living people who naturally have higher levels of vitamin D, within the ranges I've already mentioned, they actually have less cancer, less heart disease, less stroke, less falls, less total mortality, less infectious illness, like COVID-19 and so on. And so there's this discrepancy between a blood level that's achieved with a supplement, a synthetic supplement, and a blood level that's achieved by natural means. And there are a couple of bright spots for vitamin D supplementation. There's a tiny benefit, perhaps, for respiratory illness in general. Now, the level is maybe the difference between, for example, 62% and 63% over a course of a year. Meaning people who took the vitamin D supplements, only 62% of them got a cold. And the people who didn't take a vitamin D supplement, about 63% of them didn't get a cold. Got a cold, I mean. So the degree of benefit is so small that most of us would consider it clinically insignificant, but it's there. And some studies show us a small reduction in the progression of people with prediabetes to diabetes. This is what's interesting because we know that there's a strong relationship between low vitamin D and higher rates of type 2 diabetes. And so that's why this study was done. In actual fact, the degree of benefit from the vitamin D is quite small, but it's not zero. What about vitamin D supplements for osteoporosis? Many of you are taking vitamin D because your rheumatologist or your endocrinologist or your primary care doctor has told you to take vitamin D because it reduces your risk of osteoporosis or fractures. I don't think that's the case. I think that's wrong. And so we know that people with more vitamin D in their blood from natural sources have fewer fractures. However, if we give people, free living people in the community, if we give them vitamin D supplements, we do not see a reduction in bone loss. We do not see a reduction in fractures. And the only group that might benefit from vitamin D with respect to osteoporosis appears to be maybe the people in institutions, so who are in like assisted living facilities and nursing homes and such. This is really important because if you're somebody who's depending on vitamin D to reduce your risk of osteoporosis, the complications of osteoporosis, you're probably putting your faith in the wrong place. While we're at it, we should mention that there is a toxicity associated with vitamin D supplements. Pretty rare. You have to go to high levels. But high blood levels do seem to be associated with a little bit higher all-cause mortality for reasons that are not clear. And yet, even though there's higher death rate in that group, they have fewer colds and things. So it's kind of conflicting data. If you go really high, then you're at risk of hypercalcemia, which can poison just about every part of your body. And so, but you have to get pretty high to get that. And this leads to one of the safety issues around nutritional supplements is occasionally the factories get it wrong. And so the nutritional supplement you're getting, instead of having 1,000 units or 2,000 units of vitamin D, might be having 200,000 units of vitamin D in it. This has actually happened, and this causes poisoning in some people, primarily through hypercalcemia. A few people are sensitive to vitamin D toxicity, much lower levels. There are certain disease processes, but those are pretty rare, and so I won't go into them here. But overall, we're going to be getting onto what the alternatives to vitamin D supplements are. But if you're taking a vitamin D supplement and now you're all fussed about whether I'm telling you that they're killing you, they're not. They're probably just a waste of time and not achieving what you're hoping to achieve. In which case you might be saying, well, why has my doctor or nurse practitioner or a naturopath or something, why have they told me to take vitamin D? And I don't have a good answer to that, except to quote Sir William Osler from the early 1900s. And Sir William Osler, he was a Canadian guy, sometimes called the father of modern medicine. And he said that the desire to take medicine is perhaps the greatest feature which distinguishes man from animals. And that's kind of interesting because when you think of synthetic vitamin D, it's just another pharmaceutical. So, something else before we get on to natural sources of vitamin D to mention is that some people take a supplement and feel fabulous. Now, we don't know if that's real or a placebo effect, but it might be real and unique to that person. And so, if that's the case, you remember there's this concept that Roger Williams wrote about it called biochemical individuality. So if something's working for you, then double check to see if it's really working for you. Double check to see that it's safe, but it might still be right for you, even though it might be wrong for almost everybody else. I've said that vitamin D supplements pretty much don't work for free-living people in the community. And yet we've also said that vitamin D in adequate levels is critical good for good health. So now what? First of all, we think about testing vitamin D levels and looking for a level of greater than 20 nanograms per mil and greater than 50 nanomoles per liter. And then the second objective is getting that by natural means. So what are the natural means? First of all, sunlight. Sunlight without sunscreen is probably the source of maybe 80% of the vitamin D in humans running around. So it's still the dominant source of vitamin D in humans. And so we recommend somewhere around 10 to 15 minutes of, for example, midday sun. You can make vitamin D with lower levels of sun as well, with the maximum amount of exposed skin available. So this is a good case for nude sunbathing and avoiding sunburn. So by keeping it short, 10 to 15 minutes, you get maximum benefit and minimal risk. And we'll talk about the health benefits of sunlight in just a moment, especially for those of you who are concerned that I've just given you skin cancer. A second source that's really effective is oily fish and cod liver oil. So in our practice, we recommend 2 or 3 servings of oily fish a week, and that can be salmon, herring, sardines, things like that. Or a tablespoon of cod liver oil 2 or 3 times a week. Both those are hefty sources of vitamin D. And we also find that things like cod liver oil really help people with disorders such as dry eye syndrome. So it has other benefits as well. Other food sources of vitamin D partly depend on the situation where the animal's raised. So for example, wild salmon has a lot more vitamin D than farmed salmon, apparently because of sunlight exposure. Same for eggs from free-range chickens have more vitamin D than eggs from caged chickens. And so as somebody who has chickens in my backyard, then I'm a big fan of free-range chickens, as you might guess. Something else that's really kind of odd is that weight loss improves vitamin D levels. And we don't really know how important this is in terms of overall vitamin D literature, but weight loss for a lot of our patients, like 2/3 of them, it's probably pretty important anyway. And so you can go to GreatMed.org to see our ideas on weight loss. And we also have a podcast called Make Your Own Ozempic to help you with making good decisions to lose weight healthily. Finally, here's kind of a bizarre idea, but if you put out mushrooms in the sun for about an hour, you can make thousands and thousands of units of vitamin D per cup. So that's another form of vitamin D that's actually clinically useful. So the source of vitamin D for you that are healthy, that are associated with better health outcomes in general are going to be oily fish, sunlight, other foods such as eggs from free-range chickens, and mushrooms. So let's talk about sunlight and think about the positive effects of sunlight. So the sunlight, first of all, raises vitamin D levels. We've touched on that, and was the original source of, and still the dominant source of vitamin D for humans. It also does various other things, increasing nitric oxide in the systemic circulation, which does all kinds of beneficial things around heart disease. It improves mitochondrial efficiency during exercise. It improves weight management and markers of the metabolic syndrome and prediabetes. And many of these benefits through sunlight are independent of vitamin D. So don't think of sunlight as just being a vitamin D source. Think of it as having all kinds of other benefits, including through the nitric oxide pathway. Now, it does have negative effects. Melanoma, aging skin, cataracts. And so we'll talk about that in just a minute. And actually, just touching on the melanoma thing, it can be argued that melanoma is dominated by people who sunburn, especially sunburn in childhood. So let's look at something in a study of Swedish women followed for 20 years. So this is almost 30,000 Swedish women followed for 20 years in southern Sweden. And the people in that group, the women in that group that had the highest sun exposure, lived anywhere from up to about 2 years longer than those who had little sun exposure. And this was all adjusted for various socioeconomic factors as well. And the increased life expectancy in those people that got outside in the sun was primarily attributed to lower cardiovascular disease risk, which we can see benefits from sunlight for both the vitamin D on heart disease risk, as well as the nitric oxide pathway for vitamin D for cardiovascular disease risk. And there's probably other pathways, of course, as well. And sort of put this into perspective, avoiding sunlight exposure had an equivalent effect on your risk of dying as smoking. So in other words, you can see sunlight in this context as a nutrient. And so then if you looked at, so this is 30,000 women. So a lot of those women in this group had melanoma. And if you looked at the people who had melanoma, sunlight exposure was still associated with a lower total mortality. In other words, their risk of dying was less if they had sunlight exposure. And so, once again, just repeating, we think that you should have maximum number of square inches of skin exposed without sunscreen, probably for about 10 or 15 minutes. Some amount that doesn't cause burning. And then if you're going to be out in the sun for longer than that, just put on clothes or whatever to protect your skin. And don't worry too much about the fact that your vitamin D level from the sunlight is going to be higher in summer, of course, than it is in winter, because humans, for the entire recorded history of humankind, have always had higher levels of vitamin D in summer and lower levels in winter. So we sort of think of that as normal. And this is just an example of the what we call the intelligent design of the body. The fact that all of these tools we have to make use of the normal design that's built into our body so that we don't have to be dependent on big pharma. So let's talk about melanoma and sunlight specifically. When you look at melanoma, then sunburn and recreational sun exposure and tanning beds appear to be the strongest contributors, whereas chronic sunlight exposure, so that's the farmers, linemen, surveyors, who are getting occupational sun exposure on a chronic basis, don't seem to get melanoma more than the general population. And so that also leads to the question of, should we be using sunscreen? And sunscreen is far from clear cut as to whether sunscreen really is helpful, except for in terms of aging. And so, being a sort of an anti-chemistry kind of guy, I would suggest people have more protective clothing and hats rather than sunscreen. But that's more of an individual choice. And remembering that melanoma is highest in risk in young women and elderly men, and getting sunburned as a child. So, to summarize on your use of vitamin D, we would argue that vitamin D is critical for health, but synthetic supplements are of dubious value, if any value, except in the very, very deficient. In that group, there's lots of natural sources of vitamin D for that group anyway. I mean, originally, they used to just take the kids who had vitamin D deficiency and stick them in the sun. Use sunlight and food to improve your vitamin D nutriture, and not just to improve your blood levels of vitamin D, but the overall improvement in health that comes with that and comes with those habits. Thank you.